Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy, and I'm going to discuss a surgery called inferior turbinate reduction surgery. This is a very common procedure that's done to help improve people's airflow through the nose. So coming off the side bottom portions of the nose are these structures called the inferior turbinates, and they're often too large and obstruct people's nasal breathing. Now, if nasal steroid sprays and other kind of nasal medications are not enough to take care of that problem, then turbinate reduction surgery can often help improve people's breathing through their nose. So to do the surgery, it takes about 15 to 30 minutes to do. People are under general anesthesia, so that means they're completely asleep and have no pain during the surgery. While they're asleep, I inject some numbing medication. I make an incision along the bottom edge of the turbinate. We expose some of the bone and we resect some of the bone and the skin or mucosa that's around the turbinate. And then I cauterize the bottom edge of that turbinate and wrap the cut surface back over the exposed bone. We do that on both sides and wake the person up. They don't have to have any splints or packing in the nose, but they are going to have some scabs and crusting that are there for 2 to 4 weeks after the surgery. People typically breathe better immediately, but sometimes with the scabs and clots and crusts and things, they don't breathe very well until those scabs and things come off. The biggest risk of this surgery is excessive nasal bleeding. So everybody bleeds some after the surgery despite our cauterization, but some people are going to bleed excessively. That's rare, but it can require a trip back to the operating room to take care of things. Anytime we do any nasal surgery, we work vaguely around the eyes and the brain, and although those risks are extremely low, people have the rare risk of having injury to the eyes or brain, spinal fluid leaks, meningitis, blindness, double vision, injury to the tear ducts through the nose. But fortunately with this particular operation, those things are exceedingly rare. I'm very happy to suggest this surgery to people because I think they typically get very nice outcomes. After surgery, I like people to rinse their nose with a sinus rinse kit. This NeilMed sinus rinse kit is one that's commonly found, and it's a very good one, but there are other brands, and I don't really care what people use as long as they flush their nose out to help keep it clean. We don't want people blowing their nose afterwards because that can stir up some of the bleeding. We prefer for people to be off of any aspirin or NSAIDs like ibuprofen for a week leading up to the surgery. If people have been using nasal decongestant sprays such as Afrin, we definitely like for them to avoid those for 2 weeks before the surgery at a minimum to try to help reduce some of the bleeding. But sometimes that's not possible, but most of the time you should avoid those things if possible. It's not bad to have some Afrin or oxymetazoline on hand postoperatively, because if you are having some excessive nasal bleeding, then a couple squirts of that may help slow that and give it a chance to clot and keep people from having greater problems, although that's almost certainly not going to be necessary. If people have some excessive bleeding, now again, everybody's going to have some bleeding, but if you have excessive bleeding, then you may need to go to the emergency room to be evaluated for that. We can always be reached at 803-936-7530. We're available 24/7 for any kind of emergencies or complications. Really, afterwards, you will sometimes need to be on some antibiotics. You may require some pain medication that your doctor's going to prescribe postoperatively, but that should be about it. Overall, this surgery as compared to septoplasty or other kinds of sinus or nasal surgery is one that's typically a lot easier to get through and a lot better tolerated. So, hope this helps. I think you're going to breathe much better. Thanks.